Kitchen talk, conversations that cook. Kitchen talk, conversations that cook. What you want to talk about? Kitchen talk, conversations that cook. Kitchen talk, Lisa, Loque, JT, and friends. Kitchen talk, conversations that cook. Kitchen talk, conversations that cook. What you want to talk about? Kitchen talk, conversations that cook. Kitchen talk, Lisa, Loque, JT, and friends.
Lisa, Lorraine, JT, and friends. Y'all ready to pick up some conversation? Come on.
Kitchen talk.
Let's talk.
There it is.
Yay! Hey,
Hey.
hello. Welcome. Kitchen Talk, CTC.
Conversations that cook.
Yes, they do. I love it. Oh my goodness. Super excited. I know, right? Oh my God. So let me give this disclaimer. I am usually in the kitchen.
Okay.
But the kitchen is processing a huge baking project right now.
Okay.
And y'all see where I am. I'm not in the baking project.
Will we get a chance to partake in the treats that are being made in this?
That looks like a no.
Well, I will say this: it is not my baking project, so I can't give out anything. So here, there it goes. Not my baking project. Oh my goodness. How is everybody doing? Welcome back, Tanya Tatum, Susan Baker. Oh my God, we are always excited to have you guys on the show. So welcome back.
Thank you.
Yay. So I thought it would be very important because I think the last time you guys were here, it's been about a month or so now. And there are so many changes, like day to day changes, minute to minute.
Right. Exactly.
Changes
Wow.
with what is going on with COVID-19 and the pandemic and vaccinations, and people are bombarded with information. What do I believe? What don't I believe? Is this information current? Is that information current? And we at Kitchen Talk, we really, really want to make sure that people stay informed. So that is another reason. So we talk about a lot of stuff, and I guess it may seem repetitive to some people, but not to us, because we think some of these things need to be on the forefront of our minds almost like at all times. So that is what we're dealing with today. I also will say and give this disclaimer: I am not a COVID expert, nor do I have any medical background other than working in a doctor's office, but that was at the desk. Like, your appointment time is.
You still pick up stuff there.
That is it. That's my extent of medical experience.
You still pick up good information there, though. Don't discount that.
You're right.
That's right.
So much happens at the front desk. Without the front desk,
that is true.
Can't make it happen.
True.
That's
That
right.
is true. But I knew I had to leave when I started crying with the patient. I was like, okay, no, it's time to go. This one lady, she was like, oh, he's sending me to the hospital on this Mother's Day. And I'm like, oh, no. I was like, okay, no, it's time to go. It's time to go.
Yeah, right. Good call.
It was time. It was definitely time. I love my job. I love the doctor that I worked for and the people, but I was like, no, when you shedding tears with the patients, no, you probably need to get up out of there. So I want to start with this. Um, this is a question that I have, and I want to start with this question, and we'll get into the other things. But can you, one of you, explain to me what herd immunity is? I keep hearing it, and I think I know, but I'm not quite sure. And it's like this term that's just been thrown out and is constantly repeated. So I don't know whether Dr. Baker or Ms. Tatum, whichever one of y'all want to address that.
You want to start, Miss Tatum?
Okay, I can start. Basically, herd immunity is when enough people in a population are vaccinated so that you stop that chain of transmission. The one thing that we know about, particularly about COVID, it's transmitted through air. And if one person gets it and you're around other people, several of them are going to get it also. So if you've got herd immunity and say 80% of the population is vaccinated or immune to it, if you have that one person that does get it, they're not going to transmit it to as many people because they're all immune. And what you try to do is when you stop that chain of transmission, it's not usually just that one person. You start with one person that's infected, they may infect two people. Each of those two people will infect two more people. But with the herd immunity, you stop that. It doesn't go any further or much less further. So that's why you try to get as many people vaccinated as possible, because you always have people within a population that can't get vaccinated. Individuals who may be immunocompromised or may have cancer or some other disease or illness that they absolutely can't get vaccinated. So you want as many people possible to protect those individuals.
Right. And here's a real life example of why why herd immunity is so important. You have a wedding. This is a real life example. Wedding party, 51 people at the wedding, which is well within the numbers in which we said we are going to operate. One person at that wedding party had COVID-19. That one person, of course, mingled among the 51. These people came from different parts of the country. Someone contracted COVID-19 from that person. They went back to their state. They happened to work in a hospital. So they then gave COVID-19 to their employees and to some of the patients. The employees then go home and she gives COVID-19 to her son. So here we have a small little party of 51 people that now multiple hundreds of people got COVID as a result when they did the contact tracing. So that's an example of why herd immunity is so important. And we are not close, unfortunately. We're only, as I looked, 44 to 46% of the population in the country vaccinated, and we need 70 to 80 to be able
that's
to.
only a single dose. That's not even everybody that has both that's fully immunized.
Exactly.
Number one, let me say this. I got both of my shots. I need to say that out.
Yes. Woo!
You guys are doing a phenomenal job at FAMU. I love it. The staff was great. Everybody's moving. There's not a long line. So a lot of the things that people would, say this is why they won't go were eliminated. It's very easy. It was smooth. They even sent me a reminder text message that the second appointment was coming up. And I took a picture too. So share the word. So my question really is, and this is what we've been hearing a lot of, if I get the shot, do I still have to wear a mask? Do I still have to stay away from people? I'm still going to follow those guidelines, but what do you guys have to say about it?
Well, let me start with the disclaimer I should have started with at the beginning. I am also not a COVID expert. However, I am a medical healthcare professional. And so a lot of what you will hear from me is from that perspective. And so I think that even though you have been vaccinated, you still need to wear a mask. Here is why. you still can get COVID. Now,
Yeah.
granted, you will not get it to the degree that you would have gotten it if you were not vaccinated. However, you still don't want those symptoms. And then you may then take it to someone who has not been vaccinated.
That was my
So
biggest
still,
fear.
you think about yourself, but let's also think about our fellow man and being able to protect them as well. So my answer to that is yes.
I'm kind of in the same vein. I will say that the CDC did adjust the guidelines a bit so that if you're outside, if you're engaged in other activities outside, then you may not wear a mask if you're fully vaccinated. Now, fully vaccinated means if you've got Moderna or Pfizer, you've got both shots, and it's been at least 2 weeks past that date. If you got the J&J vaccine, that's a one-dose vaccine. That means that you're 2 weeks past that one shot. So in those instances, you don't have to wear a mask. But I'll be honest, around other individuals, in any kind of a large group, I'm going to have my mask on.
Yes. I agree. I felt the
My
same.
rationale is enough people haven't been vaccinated to make it safe for me to do that. So
Correct.
And here's the other thing we know, that the mask has protected us from not just COVID-19, but from a number of other illnesses that we would get if we were not wearing the mask. Any other illness that transmits by respiratory droplets. So, and we have seen then a decrease in some of those other illnesses as a result of us wearing the mask, protecting us from COVID-19.
I was thinking that, especially with the flu, you know, the numbers for the flu kind of dropped because people
They
were.
did.
Yes.
Yes.
I thought about that. I thought
they
about
were
that.
way down this year.
Right. And we were concerned about that as health professionals, that people would get a double whammy of the flu and COVID, and that's going to do you in. I mean, you know, it's just, and so we avoided that, you know, thank goodness.
Wow. I was thinking that too. It wasn't a lot of, usually somebody in the office gets the flu, you know, whatever. But we didn't have a whole lot of people out sick, or, well, obviously, because we're not even out with each other.
Right.
So some of us working from home, some of us, you know, during what would have been the flu season, we were pretty much at home, and not doing too much outside or mingling with other people. So that was true. That makes sense. So are we? So here's another thing that I've been noticing, or recently. I went and picked up dinner, so I don't cook as much either, but I went
You
and
should
picked
be
up
cooking now. You're at home.
My kitchen is for kitchen talk.
Okay.
So I noticed today, nobody in the restaurant, the workers in this particular restaurant, had on masks today. And so I know, or I heard, I didn't see it for myself, but I heard that Florida no longer has a mask mandate. Is that true?
That is true. The governor has lifted, unfortunately, the governor has lifted the mandate for masks. There are multiple businesses, however, around the city that said they will still issue the mask mandate in their places of business. But
I love that businesses like Publix, you know, are still holding true. Winn-Dixie, you know, the stores, they're still holding to the mask mandate. And I'm hoping at least some of the restaurants, if you work at the restaurants, you still cover up too. You know, we want to keep. I think my biggest issue was giving it to somebody else. You know, somebody who's older. You know, that's kind of the scary part about all of this.
Yeah. That's going to be a challenge for us because we haven't reached anywhere close to herd immunity yet. And so there's still a fair amount of transmission and of community transmission going on. So it's up to individual businesses. It can't be the county or the city that makes those decisions anymore. That's been taken away. I know at FAMU we're still going to be wearing masks for a while because that's what we need to do right now. And as the numbers of people that are vaccinated increase, we may revisit that. The CDC may revisit that, but right now the mask is still really important.
What is the age limit at this point for FAMU? Is it 18 or is it younger?
It's 18 for us because we have the Pfizer and we have the Moderna and the Johnson & Johnson vaccines, which are only authorized right now for ages 18 and up. Now, if you go to another provider and they have Pfizer, 16-year-olds can get, 16 to 18-year-olds can get the Pfizer. And we're expecting that the FDA will make approval this week. They keep telling me Friday. I don't know.
Friday. That's what I heard too. Yeah. Friday.
But that they're going to go ahead and approve the Pfizer for 12 to 15-year-olds. So everybody from 12 years old on up can get the vaccine, can get vaccinated against COVID. So we're hoping that comes out.
That's like he was driven.
So how's that going to affect?
Sure, I can hear you.
School age kids when we get back to school?
I know they have put in requests they haven't put the request in. They're already doing clinical trials on 10-month-old and up. So for school age. And I expect that there may be a request for the FDA to approve that sometime in the fall. Probably early September or so, but it won't be before school starts.
And so as far as we know, I know for FAMU and other colleges and universities, we're like coming back full force, like regular, but pre-pandemic.
Right.
Exactly.
Yeah, we got that announcement today at Florida State that we would be coming back pre-pandemic in the fall.
Yes, the Board of Governors released something today, and all of the state schools will be pre-COVID operations for the 21-22 school year, academic year.
I would like to add in at this moment, we need to vote, people.
Here we go.
Fan base, let me tell y'all, we need to vote because they're playing games with your lives at this point. You know, they are playing games with your money. They're playing games now with your health. They are playing games, and we are definitely suffering more because of it. So,
yeah.
We need to vote.
Yeah. And like before,
go ahead.
Especially people of color, we are still disproportionately affected by COVID-19. Still. And there is more vaccine hesitancy in people of color than there are in the majority population. And so going back full force is going to be a problem. It's all I can say. It's going to be
knowing my school, knowing FAMU, and I'm a graduate. I've worked at FAMU from the pre-K all the way to the college. And there's a lot of elderly folks that are still on staff that are still, I call them my mamas, my aunties, they still there. They're working. And, I would hate to see one of my colleagues fall because of, it's like the cold season. In the cold season, my colleagues used to laugh at me because I kept a Lysol spray in my office. I was spraying it up pre-COVID. Yeah. When COVID hit, I was like, oh, we understand now. Because, kids will come in and it's a common cold, but that could take somebody out at this point.
It's that's why vaccinations are going to be so critical for us. I have conversations every day with individuals about vaccines and if they've gotten them, if they haven't, why not? What are their questions? I try very hard to try to answer questions so that they can make a good decision. And sometimes there's just not a real reason. It's just, yeah, I think I'm gonna wait. I don't know how to conquer. I think I'm gonna wait.
Yeah, when you get that answer, tell me.
Yeah. So I just, that's the one thing that we have that can help protect us. I mean, I saw a report out today that said that COVID is actually exacerbating individuals that have diabetes, particularly type 2, and that they're actually throwing people post-COVID into diabetes. We don't need that as a population.
Absolutely not.
And it's got something to do with the biology and the impact on, it's just something that I think is going to affect us. We're going to be finding out about how COVID ravaged the body for 5 or 10 years from now. And this is one thing I think we can do to help protect us. And so I'm kind of like, okay, what do we need to do next so we can get more people vaccinated? Because I'd like to try to overcome your concerns and fears because we can't afford to, well, it's not that bad. My friend had it and, they were fine. They had sniffles for a few days and that's it. That's what you know about. What they don't know is that there's probably a lot of other things going on. People go, oh, I just lost my sense of taste or smell. It came back. Well, but that's neurological damage, You don't know what else might not be working right. I mean, we just don't know enough about it. So I'd rather do what I can to not get it. Right. So whatever we can do to help people kind of conquer their concerns and hesitations and fears about the vaccine is going to be really important, particularly in the African-American community, in the Hispanic community, in all of our minority communities, because we're the ones that are frontline workers. We're in the healthcare field. We're the ones that are dying and getting sick and then find out, umpteen years later, oh, that's why this happened.
I think that's the biggest thing is because we don't know. There's still a lot of unknowns. Like yes. even with the vaccine, and as I stated, I got both shots. How long would it last? Would I have to get vaccinated again next year or in 2 years or in 5 years, like the tetanus shot? Yeah,
like I don't know. Booster.
A booster, yeah. Right. Like how's that going to work? That's still.
Right. And we don't really know the answers to any of that. But what I tell people as I'm talking to people who are hesitant, here's the thing that we know. 576,000 people are dead in this country from COVID-19. We know that as a fact. Mm-hmm. So while we may not know many things about the vaccine, we know that it can protect us from being one of those people, for being in the 570,000 plus thousand people that are dead. That's the thing we know.
So here is my question. How do you develop a vaccine for a disease that you don't know a lot about?
Oh, well, let me tell you a little bit about it. I was really fortunate to be on a webinar with Kismia Corbett, who is
nice.
a Black scientist who was actually working to develop the vaccine. And remember when we heard about SARS and MERS, and they were primarily found in the Middle East, and it was a coronavirus. So they've been working on viruses for 10 years, 15 years. And so they had already been doing all of this work. So when this one came up, they just built on what they had already done.
Correct.
So it made it, that's part of the reason why they were able to get the vaccine done so quickly.
Right.
It wasn't because they skipped corners or, cut things out. They've been working on coronaviruses for a long time. And they were able to jump right on. They could find the particular spike protein on this particular one, and they ran with it. But in the technology that they use for the Pfizer and the Moderna, the mRNA vaccine technology, that's 10 years old. It's not new. So,
and the other thing is, it was a global crisis.
Right.
And so it was all hands on deck. Everybody who had knowledge came together across the world to get this thing done. And so while it may have seemed quickly, you have to think about the thousands of people that were involved in its development.
I'm happy you said that, because a lot of people are afraid to get the vaccine because they think it didn't go through a process. It wasn't vetted, and they just put it together. So I'm happy you shared that it was a collective work, and that this is not new development. They've been working on this. But it does bring up an issue with me when it comes to the scientific community. Like, okay, you did the coronavirus, but we got a lot of other viruses that's been killing people worldwide. AIDS, number one. Cancer, number one. I mean, we could keep going down the list. And I'm like, well, what? All hands were on deck for COVID, but we needed all hands on deck for a lot of these other things before COVID.
And here's one thing, just to kind of give some perspective. COVID was one virus, so to speak. You think about cancer, for example, just breast cancer. There are 10 different types of breast cancer. That's just 10 types of one cancer. So if we talk about all the cancers that there are, and there are multiple types of cancer within that one type of cancer, that's years and years and years, 10, 20, I mean, it's years of work for us to get there. And so while people are working, I think the magnitude of the disease, like cancer, is so big that's why we can't say, oh, we have cured cancer. Yeah. People are working though.
Yeah, I'm trying to find something for you guys as we speak, because there's a particular doctor, I shared her name before, who she has developed a cancer fighting treatment, and she's looking for support so that she can go into the clinical trials. So it has worked in mice and other animals. She's using radiotherapy, I believe, to kind of focus in on the area. But again, I feel like there's so much. I agree with you. There's a lot in terms of areas of cancer, but we have a lot of people who could get on the job. A lot of people. You just stated how this was a worldwide, all hands on deck situation. And I'm happy that they found the vaccine. As we stated, there's still a lot to learn, but we got a long way to go.
That's kind of what I'm thinking too. Like, what is okay? Here is this that to us comes out of the blue, but now you're saying scientists kind of knew a little bit here, a little bit there, and then they all came together and put some stuff together. So it's really boggling my mind, like, what's gonna be the next thing? So is this gonna be it, or are we prepared? Are we preparing for the next thing? If everybody we open up the world and everybody goes back to business as usual, but we still don't have what we're saying as herd immunity, are we gonna see more spikes and more deaths?
And we got the variants, just like you said with the cancer, there's variants to COVID.
Right. And so what does that mean for this vaccine? Does this vaccine protect from the mutation of COVID-19?
For right now, it's relatively effective. It's pretty effective against most of the variants that they've identified that have been spread the most widely. But the longer it takes us to get folks vaccinated, the more opportunity there is for more variants.
That's right.
To come up. And it's you know, the virus takes advantage. You know, it's like, oh, you blocked me here, so I'm going to do this. And they're just simple genetic mutations that allows them to work around whatever fix you put out there. And that's what happens. So we are hoping we can get enough people vaccinated to kind of take the pressure off so that we don't get many more variants out there. But, you know, I don't know. I don't know. You asked Lisa how, you know, what's next. I couldn't tell you. I really couldn't. And the reality is, it could be a totally different virus in another 5 years or 6 years. And I think I'm in healthcare. I dealt with, let's see, let me go back. We dealt with H1N1. We had swine flu. We had Ebola. I mean, there were all kinds of things that keep coming up. So yeah, there's going to be another one at some point. And I think this one really brought it home to people that how easy it is to move from one place to another. This is such a mobile society. Everything flies on an airplane anymore. And, you know, it can be in China and the next day it's in Seattle. And 3 weeks later, it's in Florida. Boom, there you go. So, you know, there are a lot of things we can do. I think from a national level, they're going to put the pandemic plan back in place that our previous administration got rid of. Because when the Obama administration left the office, there was a plan in place. There was a, you know, a group that were committed to working on that. They got disbanded. The plan got pitched. And I'll be darned, that's the year we actually get a real pandemic. You know, it's crazy.
It is. And I think, again, that's why it's important to vote. Once again.
And you don't think about that when you go to vote, but it really, impacts so much of your life, you know, or has the potential to.
Right. And that's why it's important to be an informed voter, not just to vote, but to be informed, to actually pay attention to, because we know that there are little subtle things that get hidden in legislation that we don't, you know, that some party is vying for. We say yes, and we didn't read everything. And so there's something that negatively impacts us that we voted yes on, because we were not informed completely. So it's not just important to vote, it's important to be an informed voter.
Yeah.
I love it. You know, as you stated that, I was thinking about how important it is to have Black researchers, Black research in terms of how it affects us in our community specifically, and how important it is for us to continue to push the STEM, you know, curriculum so our students, you know, go into fields that will help battle, you know, issues that we don't even know about, right? There's going to be more, but we need to be prepared on the front line, just like the Obama era did. They didn't know this was going to happen, but they had a plan in place, right? So that it does happen.
Yeah.
Well, I think during his administration, we had the
Ebola.
Yeah. It didn't get to pandemic, but I think that might have sparked that legislation of him putting those kind of things in place. Here's another question. Do either of you know what our numbers look like here in Tallahassee? Like, are we doing better? Are we doing worse? What are we doing?
I looked at Leon County, and it's like we have 31,887 cases, I think is the last thing I looked at, and over 300 people have died, and that's just Leon County.
Yeah.
And we're only 30% vaccinated in the county, from what I saw.
And I'll be honest, we're seeing an increase in the number of cases right now. And now the case numbers are way down from where they were, 4 months ago, but at the same time, it went to a level and now it's creeping up again. And I'm concerned because one, we saw a little bit of a rise after Easter. It was graduation a week ago. I got another bump. We've got Memorial Day coming up. We've got the 4th of July. And every time when we gather, when we celebrate, we throw everything to the wind, have a good time, and then we get more cases. So we've got to be careful. Don't want to tell people don't do it, but at the same time, get the vaccine. That's the way. That's our ticket to doing those things. Right now, it really is.
So that's the scary part, is that, even before the vaccine, you had people partying, having a good time. I consider myself very much a socialite. I have changed my ways. Completely. I got friends calling me, "You come?" No, I'm good. I'm good.
I try to think about the last time I was in a restaurant to eat. It's been more than a year.
Around 13, 14 months for me as well. Same thing.
It's been more than a year.
I know we still want to get out, and then I still wear my mask and cover up, make sure I wash my hands, I carry sanitizer, do as much as I can, and even with large crowds. But when we talk about our college age kids, when you have mom and dad at home, you having a house party, 40, 50 people in the house, or even 15, 20 people in the house, it's okay, so I don't know what can be done to combat that. You talked about holidays, but what about when school comes back and of these? You talking about people from everywhere,
that are coming back to an environment that we have now opened up.
Correct.
Again,
and we're all living together. They're living together in residence halls that will be full. Two people to a room.
Again, that's why we have to push vaccination. Again, another reason why it's so important.
We were trying to think of how to incentivize it for our students, and how do I give you something that will encourage you to go ahead and do it, and it's kind of crass, but at the same time, it's that important,
It's funny you said that. Because I saw that somebody was giving a pizza. You get a pizza, you get the vaccine. I was like, oh.
Well,
somebody else is giving beer.
Yeah.
They're giving away beer. Now, I can't do that. I can't give away money. But, we're talking with folks at the health department and everywhere else. What can we do to incentivize it? Because this last bump that we've been having with COVID have been mostly with the younger population, because the older individuals, I put myself in that group at this point, we got vaccinated. Okay.
Hello.
So the individuals between 18 and 35 or 40, that's the group. That's the group that really got to figure out what is it going to take to increase the numbers of them that are going to take the vaccine. I'm trying. I don't know.
Well, you're doing a great job.
Going, hey.
I like I said, I love what FAMU is doing. They've been on the forefront from the beginning. Like I went out there to get checked. I was happy to see you in the line. Hey, Miss Tatum. And even just the setup. It was done so well that it doesn't make sense that we're still far behind in the numbers like that. So, I'm going to do what I can to share the word and share, hey, get vaccinated as much as we've been doing it in our fraternity meetings and telling our brothers to get vaccinated, young and old.
They're giving money. You see that? Publix is giving money to employees.
I should have waited to go to Publix.
But now, if you pay somebody to get vaccinated, does that make you liable if something happened to them?
Oh, I'm sure Publix is making them sign a waiver. You better believe that.
Yeah.
Yeah.
You can
Publix is making them
incentivize
sign a
it, but
waiver.
it's still that individual that makes the choice.
Right.
So-
True.
Yeah.
So I do have something else because I saw this recently. I got my card, my little COVID card. I was happy. I got it tucked away. I actually need to go and get it laminated because
Yeah.
I saw that there was a doctor who was giving out fake COVID calls. Did y'all see that? Fake.
Are you serious right now?
I did not see that.
He was giving out fake. It was not a doc. It was a bar owner. I think it was a bar owner who was giving out fake COVID passes, and people who've been getting them and walking around like I got vaccinated, but you haven't. How does
There's a
that
black
hurt?
market for everything. There's a black market for everything.
Right.
Why do you need the COVID? Why do you need the I've been vaccinated COVID card? What do you need that for?
See, people are thinking they're going to need it for travel, which we don't know yet how that's going to pan out. You know, that before you get on a plane, you got to prove you've been fully vaccinated. I mean, maybe not. We don't know. And so people are doing that. The silly thing about that is, okay, you got a card, but you're not vaccinated. So you still could end up on a ventilator and die. I mean, that's insanity.
It's insane.
It's crazy.
Insane.
Yeah.
The
Unless you
thing
know
is,
what you want to do for that moment in time, but
Exactly.
it.
So you travel and get COVID and come back, and then what?
well, he's been caught. They found out and they caught him. So hopefully that's the end of that. But Lisa, another thing about, and I had this conversation about the card. You know, we've been getting carded for all other type of vaccines, but we had nothing to say about that. Now, all of a sudden, it's COVID. I need a card.
I was going to say, I don't remember ever being carded for school, I guess.
So
Yeah, school. That's the only place I thought.
Okay. Yeah.
I worked in
That you have
healthcare.
to show immunization.
I had to get a couple of other shots, and they give you this yellow card. You got to keep it, and to make sure that this is the date that you got the shot, so that you could get the next shot whenever that happens. So I was shocked that this guy actually created a fake card and people were using it. It don't make sense.
Here's another one. Publix gave $10 gift cards for shoppers who got their flu shot, and Krispy Kreme gives a free glazed donut to anyone who shows their.
Now, see, that's a mess. That's a mess. That is a mess. You're trying to deal with COVID. Now you got COVID, diabetes, heart attack. Come on, Dunkin' Donuts.
Oh God.
Oh Lord.
I guess you gotta do what you gotta do.
Mess. So here's another question. So I hear the commercials that they have out now is, we could come back together, and they showing pictures of people hugging each other and all of this stuff. If we get vaccinated, this is what we can do. 2 questions. Can you get COVID again? And are we given a false hope? Because they're making it sound like we can get rid of COVID once we get vaccinated.
Yes, you can get COVID again. That's the first answer to the question. Even if you're vaccinated, if you've had COVID, you waited the time that, the proper time and you got vaccinated, yet you can still get COVID. If you had COVID and don't get vaccinated, you can still get COVID again.
Okay.
So it's not as likely that you'll get it, but
right.
When the CDC put out the guidelines for individuals who have been vaccinated, what they said is you can gather in groups in your family or with other people that have been vaccinated. So it's not a huge group, it's a small group, an unknown group. So you either know that they're also vaccinated or they're within your own family circle. So they put some limits on that for now.
And it's like, even though you get COVID, if you've been vaccinated, what we are saying is that the symptoms will not be as severe. You are likely not to
Yes.
end up in the hospital. You're likely not to end up on a ventilator if you have been vaccinated fully.
So if you haven't been vaccinated, but you got COVID once, does your body build an immunity so that if you get it again, you'll be able to fight it off just as you did, probably better than the first time? Just a little science that I know. Does that make?
That immune response is time limited.
Yes.
So they're saying
that's what I was gonna say.
around 3 months at most.
Mhm.
And that's why they're giving the vaccine with the booster that supposedly gives a longer span of time in which you may mount an immune response to it. We don't know how long yet, but yeah. So that if you get it, you're protected for a short period of time.
Right. And even that depends on your immune system and how well it works in the beginning. So if you're someone who's elderly and got COVID, those antibodies may not last even the 3 months because your immune system isn't as great as someone who is 20 or 30, for example.
Right.
Yeah, that's why it didn't make sense to me to get the donuts. We're trying to build immunity, right? They should have gave away vitamin C packets. You know what I mean?
Oh my goodness. One donut ain't gonna kill nobody. They're just giving away one donut. They ain't
It's never one.
for a
It's like
lifetime.
Lay's potato chips. You never eat just one. You
Well, now
never-
hold on. They're just giving one. Now, if you go and buy some more, that's on you.
Oh man.
You gotta be careful also because once you've had COVID the one time, if you run into one of those variants, you can get it again.
Mm.
So
That-
that's a little twist on there
my
also.
mask. I'm keeping my mask.
I am too.
Yeah. Again, why the vaccine is so important. You know, I know we've harped, but it is going to be the key to us being able to be a little bit more freer in terms of our outings and that kind of stuff. It's just going to be the key. And we have to just continue to advocate and continue to put that at the forefront of people's minds that it is an absolute must that you get fully vaccinated against this virus. It's so important.
I have a question in terms of what research is being done at our HBCUs, specifically FAMU, but we have a lot of HBCUs that have pharmacy programs, doctor programs, medical programs that could help to find answers to these questions that we may run into in the future. What is our schools doing now? Do you guys know?
There's actually a lot going on. I don't know specifics for every school. I know I'm involved in a project with a number of HBCUs, and we're all doing setting up labs to test for COVID so that we can help get our students back in and give the school some resources and so that our students, faculty, and staff can test easily. And out of that, there are a number of other projects and research programs that are going on. Howard's involved, Meharry. We're one of the schools. There's just a lot of there's a lot of work that's going on right now.
I was thinking of Morehouse as well.
I see Morehouse is in the picture. I can't remember. I'm trying to remember all the schools that are in this project, but there really is quite a bit of work that's going on.
Yeah, we have these great institutions, but they can also be a part of finding solutions for ourselves, for our community, right? Mm-hmm. That could hopefully help others, but definitely within our community with all of the other issues that we have to endure. What type of research is actually being done from our side? I just thought of that, and I'm like, I wonder what the HBCU community is actually doing.
Well, our School of Public Health just recently got funded to do some work in vaccine hesitancy. They're going to be having some more advertising and promotional things going on. They're working with a number of different organizations in the communities, helping to set up smaller vaccine clinics. Sometimes you got to meet people where people are.
Yeah.
And so how do we set that up? And how do we make arrangements for that to happen? So that we can reach all of the population. Everybody's not going to come on FAMU's campus. So where do we go to find them? And it doesn't mean that they don't want the vaccine. It's just, it's too hard or whatever. I mean, there are all kinds of issues, but there is. And, you please in from the start. They worked with the health department. They sent some of their public health students across the state to help start up contact tracing when we were in the very beginning, early March of 2020, and help with the health department to set up their hotline, do the responses that people would get when they called the hotline, worked on a lot of the criteria that they put in place for the state. So they've been doing their part.
I love it.
So it's good that you brought that up, because that segues me into an event that my church is having. And I'm gonna let Dr. Baker tell you more about it. So we I guess we're all connected to each other in different ways. So Dr. Baker and I go to Shady Grove number 1 Primitive Baptist Church, and we have an amazing health ministry and very involved in the community. And so we have an event coming up, and it's almost twofold, because we the church has what's the name? It's some task force, vaccine task force, something. I can't even think of the name of the people. But we're doing vaccine hesitancy promotion or whatever it's called. And then we're also doing a vaccine clinic. Yeah. Right. Yep. So take it away, Dr. Baker. Take it away.
So this Saturday, one of the things that we realize is that the Northeast community, way out, it's going to be difficult for those people to come to FAMU or any other vaccination site. So Shady Grove number 1 is in a very prime spot, near 90, out Chairs Crossroad, and we are doing a vaccination clinic on Saturday starting at 9 o'clock. Emergency management is bringing their staff out, so we will have nurses giving vaccinations. They will have Pfizer and Johnson & Johnson. For those who want a one and done, the Johnson & Johnson will be available, and then Pfizer. And we will also have folks out there monitoring. We'll have the National Guard out there for traffic. We will have EMTs on site should there be any untoward effect. And so we are super excited. We want any and everyone who has not been vaccinated to please come, because we will be in your backyard. So you are without excuse for, I can't get there, I don't have transportation, for us to be able to give vaccinations to that underrepresented community. So we are super excited about that. That's going to happen this Saturday, 9 to 3. We will be giving vaccinations. We want to get as many shots in arms as we can get. And so we are excited about that.
I love it. The church is very instrumental in getting the shots out to as many people. And also helping to educate. It's not just the shots, it's the education. So that's phenomenal. But you see Dunkin' Donuts trying to outdo y'all right now.
Well, they can't outdo us on our second thing that we're going to have, and that will be May 22nd. We are having a vaccine education arena, and we will have music, and we will have food, and we will have all kinds of things to attract you as well as educate you. So we will give you information about the vaccine, things that to dispel some of the myths. No, it's not going to change your DNA. When you get the vaccine, you're not going to be a raccoon. You're going to be the regular person that you are, but you're going to be protected against coronavirus. Come on, people. So we will be doing that May 22nd, and we are again super excited about being able to educate our community. An informed person is a smart person and is a person that will do the right thing. So that's all. That's what we want to do. We want to educate folks.
Like I said, the church is doing its thing, but we might need to have some clinics at the club. I'm just saying.
You're right.
You are right. Yeah.
Yeah. But are they open? Are they open?
The club's been open.
Oh, yeah.
Been open. They got more people at the clubs than they got at the church.
Well, we ain't got nobody coming to church. Like yeah.
I will tell you, in Gadsden County, where my students and I have been vaccinating over this last spring, we went to the front of the liquor store.
Yeah.
And set up a spot. And we got 50 people in about an hour.
That's great.
To get vaccinated. Absolutely.
Wow.
Yeah. We went to an open baseball field. Yeah, you gotta go. Yeah. And they were doing home visits because some people just absolutely want a shot, but they are bedbound or can't get out. And so if that's a person who really needs a shot because they're already compromised, have a compromised health condition. So you're right in that we have to meet people where they are. A mobile unit would be phenomenal.
Yeah,
I think even with schools coming back, we already know football season is right around the corner. Maybe having those stations at the football game. So if you want to go in, fine. One, you got to get tested before you go in. Two, you can get vaccinated as you go in. So I think we got to be smart in this process. You can't go in unless you've been tested. And now that you've tested, why not go ahead and get the shot? Right. So
you can't make people get a shot before they go in a football game.
Well, I didn't say force them, but because it's there, you have more access. It's available.
You can make it accessible.
Right.
Correct.
Okay.
Nah, I mean that's the whole.
There are some schools, right, that are requiring vaccination. I thought I heard about that.
There are a lot of schools, hundreds of schools.
Colleges or
colleges,
colleges and universities. A lot.
Is
that are requiring students? No, we're not required.
The state of Florida is not, but a lot of other states and schools because they can't take the risk.
Right.
If you have an outbreak, if one person gets it, they
have to shut down. Yeah.
4 other people. And what office do you end up having to close? Or how many people in a classroom may be exposed? And so from a management standpoint, if just for thinking about how you have ongoing business operations, get the vaccine. And a lot of private schools are all requiring a lot of them. I mean, literally, they're well over 100. The whole California school systems, they've got 2 main school systems from universities in California. Both of them are mandating vaccines. The school system in Maryland is mandating the vaccine. I mean, there's a list that the Chronicle of Higher Ed is keeping. And there's a lot.
Wow.
But California has always been on the cutting edge. Again, it's important to vote. Like, where do we find these people? Where do you come? How? Yeah, that's a whole nother kitchen talk.
Exactly. Oh my goodness. But we'll put this flyer up on Kitchen Talk's social media so that the information can get out there as well. So I'm probably the only person in this group that has not been vaccinated yet.
You gotta come visit me.
I know. I'm just Susan been talking to me.
Yes. Saturday. I've been trying to get her for Saturday.
Hey, there's no excuse now. You gonna be there.
I will be there. I will be there all day, but I'm not getting vaccinated on Saturday. Nope.
Oh Lord.
We lead by example.
I'm gonna let y'all, just like I don't know if they really got shots. All them people like that they let y'all see them get shot? I don't know.
I got my shot.
Well,
Like the president. I don't know if Biden really got shot. That could be. I know how TV works.
President Robinson got his. I sat there and watched him. So when you're ready, call me up. I'll walk you through. You let me know.
I will say that the more talking and the more I hear about it, and the more this whole we opening up and going pre-pandemic.
Yeah,
Right.
hello.
And while I did get COVID the first of the year, it was pretty mild. But I know that I don't do upper respiratory problems very well. So I want to protect myself from that. So I'm leaning, but I still ain't fully there.
I'm not playing with these people.
I know that's right.
As soon as listen,
I'm gonna tell y'all honestly, I'm still just like a little nervous. I'm just not settled,
and
I don't really know how to. I don't really know how to explain it or verbalize it. The only way I know to verbalize it is it just hasn't settled in my spirit. And that's the only way I could really verbalize it. And I know that there are probably many people that feel that way. Mm-hmm. And it's not a matter of just being honorary and saying, oh, or, you know, all the conspiracy theories. I know I talk a lot of junk, but, you know, I done said I don't want to get chipped, but, you know, and I know that's just crazy talk. But honestly, the whole honest to God truth is it just hasn't settled with me in that way. To have it done, I don't know, and I don't know any other way to explain it other than that. And I know that there are other people, which is another reason why I like this platform of Kitchen Talk, to be able to discuss it and get healthcare professionals that's really gonna tell us the truth and not just, you know, fluff it up like all these commercials. Oh, once you get it, then you live and we done killed Corona. No, we ain't killed Corona. You know, that whole thing, you know, or whatever. So that's just kind of where I am. And I probably speak for a few other people. I don't know if I do or not, but that's just kind of where, you know, how I am. I'm just still just not, you know, completely settled with it, but I'm a little more open-minded and I understand it. I'm not gonna say I don't understand. I'm not closed-minded about it. I understand it. I just want to be settled with it.
So I give you a lot of credit for having us on to talk about it, knowing that and being willing to say, I'm not settled with it yet, because you're open into listening. You're giving us a platform to give people information about it. And that's a place to start, you know? Absolutely. And you've moved from where you were the last time we met.
I have a little bit.
That's great. And, you know, I'm going to take that. Take that, and we're going to talk to you again. We send another episode.
Now, next month, I'm going to say to my husband,
But the thing of it is, you know, I was talking to, I've got the youngest of my brothers it's not getting vaccinated yet. And when I talked to him, he's like, yeah, I'm not going to be a zombie like the rest of y'all. And I'm like, yeah, we haven't turned into zombies yet, you know, but really trying to listen and hear what his concerns are. He hasn't been able to say much yet, but I'm also asking him to think about the other people around him. What is it you would like to do in 21, 22 that you couldn't do in 20? You know, is there a big birthday coming up for somebody in your family? You know, like my mom she turned 80 just before the pandemic hit. So we were able to do that birthday. But I've got an aunt who is turning 85. I want enough people in the family to be able to get together for her. And I'm telling people now, if you want to do this, y'all got to get vaccinated.
Oh yeah.
So
Yeah.
sometimes taking it out of yourself and looking at
Right.
it broader and looking at it in your larger community and in your personal family, that might provide a little more incentive or motivation or just reason why, okay, maybe, and move you just a little bit closer. Think about all those things we couldn't do or didn't do, the
Yeah.
Christmas, and how you would like to see it and have it better and different this coming year.
Yeah.
And I was just like Lisa. Lisa could tell you I was in the same conspiracy theory, but I said, you know what? I'm around a lot of older people. Even though I'm staying home, there's still a lot of people that I still want to connect with. My mom, my dad, my uncles, my aunts, I would hate to go home to visit somebody and then I'm giving them something that could potentially be harmful to them. Even my students, I would hate to go and meet somebody and, I'm bringing them harm, not bringing them joy. So, that really pushed me over the edge and still being able to live somewhat. You go out, I still wear sometimes double masks. Sometimes double masks around here, but you still want to live it up and be safe and know that you're not hurting other people just by being in their presence. Lisa, I am not a zombie. I have not turned into a raccoon. My DNA is still intact. So I don't know what else. It was very mild, just a shoulder. And I followed the directions for the second shot. I will say that I took some vitamin C, airborne. I drank plenty of water, and a lot of the side effects that people has been talking about, I didn't get them. Very, very mild. So there's things we can do to ensure that the process is very, very smooth. So I think the one thing we can't be afraid of is fear.
Yeah.
So we cannot fear, what's going to happen. We just need to go ahead and make it happen so that we're prepared for whatever's going to come next. So I'm in your corner.
We'll see.
You got
We'll do it for you. I'm gonna wait for that phone call.
And I'm gonna call you, right? I'll be like, okay, I think I'm ready.
I'll be there.
It will not be Saturday, Susan. No.
All right.
I got to say this because Miss Tatum, I missed you and Miss Dr. Baker with the last show. But I was so excited because you have done such a phenomenal job. I got to say it. It's a lot of work. People don't see they don't really know. And I'm looking and I'm like, this takes a lot of coordination, a lot of effort. Even Saturday, Ms. Baker, I know it's a lot of work, that you have to do to prepare for it. So I want to give both of you kudos tonight. Really keep up the great work. Keep keeping our community safe. If you have not heard that from anybody, you heard it from me.
All right.
Thank
you.
Love it.
So this has been one phenomenal show. I love it. And we'll definitely update again next month with you guys if you don't mind coming and sharing with us.
Absolutely.
And like I said, I know some people may be getting tired of hearing it, just like we tired of Zoom. But I do believe it's such important information, and the way that it is changing, people need to be updated. It needs to stay. We need to be vigilant about what we need to do to get rid of this disease. I am working on my part. I promise y'all. I'm in full prayer and consecration sometimes.
I may need to walk with you and hold your hand.
Oh my goodness. About what to do, but I'm getting there. I'm working on it. I have not closed the door and said Although I did when the vaccine first came out, I was like, nope, y'all ain't nope. Y'all ain't got to worry about me in that. And I moved a little, like you say, Miss Tatum, I done moved a little bit. I done moved the needle just a little bit. So.
You moved more than a little bit.
Yeah.
Right there. You know, you've already invited us back for a third time. I'd say you're making good progress.
Leaps and bounds.
We're there for you. We're gonna be waiting for you right there.
And if we can change the mind of one person, if we can change the mind of one person that says they weren't going to get it and now they're in a line getting the vaccination, it's all been worth it.
Yeah. And I think so too. I mean, and like I say, I know it's important. I don't doubt it at all. And I understand it. But, you know, hey, everybody got to move in their own time.
Right.
And Dr. Baker has been very patient with me.
we try to give you some numbers, man.
I know.
Has been said 46. We're gonna double it up, triple it up at this point. We try to 10x this thing so that we really do hit the herd immunity point.
Right.
So
we
can do it. We can do it.
All right. So as you all know, we are probably just about 10 minutes over our time, but this is how we do it. Kitchen Talk. This is another reason I love this StreamYard platform. I don't know. We got to come back to the kitchen though, France. I'm sorry.
Well, I'm vaccinated. You not.
There we go.
You ain't vaccinated. I can't do that. I can't do it.
Okay.
You see how that works?
Incentive.
You see how that works?
You know what? You are not right. Oh my goodness. It has been lovely, ladies. Thank you so much for hanging out with us tonight. We really appreciate it.
You're so welcome.
Really appreciate it. We had Tanya Tatum and Dr. Susan Baker. I mean, a blast talking about something serious, but really appreciate you guys. And again, you will be back next month so we can update some more and talk about it some more. Because I think the conversation really needs to continue. It really does.
Absolutely.
It really does. Thank you, everybody, for watching tonight. If you are watching us on YouTube, hit the subscribe button so you'll never miss another show. If you're watching us on Facebook, hit the like button and you get informed when we're live and going on. So that way you won't never miss another show. Thank you so much to France for hanging out. JT had to work late tonight. Thank you, Jamal, my engineer in the background. Appreciate you so much. And we will see you again next Thursday, 9 o'clock, same place. Bye.